Rubella. The skin lesion of rubella is fine, non-confluent, pink maculopapular rash. Summary: Rubella or German measles is an infectious disease that is caused by the rubella virus. Since the introduction of the measles, mumps and rubella vaccine, it is a relatively rare condition. Rubella is transmitted via airborne droplets and has a mild clinical course. The clinical presentation begins with nonspecific flu-like symptoms and post-auricular and/or suboccipital lymph adenopathy. An exanthem phase may overlap or follow. This phase is characterized by a rash that typically starts behind the ears and progresses distally, developing into a generalized maculopapular rash. Rubella is usually self-limiting and involves symptomatic treatment. Complications of infection during pregnancy may cause congenital rubella syndrome with severe malformations, for example hearing loss, cataracts, or defects, intellectual disabilities. The rubella vaccine is a combination vaccine that protects against measles, mumps, and rubella. The MMRV vaccine also protects against varicella. Immunization is recommended for all children in addition to adults without evidence of immunity to measles, mumps, and rubella. Etiology: Pathogen causing rubella is rubella virus. Route of transmission is through respiratory droplets or transplacental. Infectivity: 7 days prior to and 7 days following the appearance of an exanthem. Low infectivity and virulence. Clinical features of rubella: Patients with rubella infection are asymptomatic in 50% of cases. Young children have a far milder course than older children and adults. The latter group often presents with prodromal symptoms, other systemic complaints, for example arthritis, and a longer duration of infection. Incubation period is 2 to 3 weeks after infection. Prodromal phase of rubella. The duration of prodromal phase is 1 to 5 days. Findings are post-auricular and suboccipital lymphadenopathy and occasionally splenomegaly. Mild and non-specific symptoms such as low-grade fever, mild sore throat, cough, conjunctivitis, headache, and aching joints. Forsheimer sign, enanthem of the soft palate. Exanthem phase. It lasts for 2 to 3 days. Findings are fine, non-confluent pink maculopapular rash, begins at the head, primarily behind the ears, extends to the trunk and extremities sparing palms and soles. Rash may be itchy in adults. Polyarthritis. 70% of teenagers and adult females present with polyarthritis. Rubella rash, a non-confluent pink maculopapular rash, is visible across this infant's trunk and extremities. Rubella. Pathogen causing rubella is rubella virus. Course is that exanthem resolves within 3 days. Complications are arthritis, encephalitis, thrombocytopenic purpura, congenital rubella syndrome. Treatment is symptomatic. Vaccine is available. Course of disease: 14 to 21 days is incubation period. Contagious period: 7 days before the onset of exanthem and 7 days after the onset of exanthem. Symptoms are suboccipital and post-auricular lymphadenopathy, Forsheimer spots, exanthem, erythematous maculopapular, blanching non-confluent, medium-sized spots. Further symptoms: good general condition, mild fever. A diagnosis. Diagnosis is clinical. Lab test CBC leukocytopenia with relative lymphocytosis and increased plasma cells. Confirmatory test serology, detection of IgM antibodies. The optimal period of serum collection is 1 to 5 days after the onset of the rash. 90% of cases will have positive IgM antibodies, which indicate recent infection. Occasionally, false positives occur in the presence of rheumatoid vector and other viral infection, for example, parvovirus. greater or equal to four-fold increase in IgG titer. A specimen for the IgG titer should be collected during the acute phase and approximately 2 to 3 weeks later. The presence of IgG simply suggests past exposure or immunization, but a rise indicates recent infection. Treatment is symptomatic: severe pruritus, antihistamines, severe polyarthritis, rest, and NSAIDs. Isolate patients with confirmed infection. All individuals isolate for 7 days from the onset of rash. Hospitalized patients initiate droplet precautions. Complications: chronic arthritis, especially women, thrombocytopenic purpura, rubella during pregnancy, torch infection, congenital rubella syndrome, rare rubella encephalitis, bronchitis, otitis, myocarditis, pericarditis. Prognosis: the disease usually has a benign course and the exanthem disappears rapidly. Giant pain may persist for several weeks. Arthralgia may persist up to a month in adults. Prevention: vaccination. Administer a live attenuated rubella vaccine, that is MMR vaccine, MMRV vaccine, according to the immunization schedule. Evidence of immunity to rubella. A rubella IgG titer more than 10 international units per ml indicates immunity to rubella. Exposure control. For confirmed cases of rubella, patients isolate patients for 7 days from the onset of the rash to prevent further transmission. Expose contacts without evidence of immunity to measles, mumps, and rubella. Quarantine for 23 days from the onset of rash and the last known exposure. It means that if you are exposed to a measles patient whose rash is 5 days old, you will be quarantined for next 18 days. Women of reproductive age without evidence of immunity to rubella should be vaccinated prior to pregnancy to prevent congenital rubella syndrome. Thank you.